Ever wondered about the science behind those tiny pills that help you sleep or calm your nerves? Welcome to the intricate world of pharmacology, the study of how drugs interact with our bodies. This field, akin to a complex dance, explores the relationships between our biological systems and the chemicals designed to alter their functions. In this realm of science, we encounter countless substances, each with their unique properties and effects. Today, we're going to focus on 3 types of drugs that have significantly impacted healthcare: benzodiazepines, barbiturates, and hypnotics. Benzodiazepines, often known as benzos, are commonly used to treat conditions like anxiety and insomnia. Barbiturates, on the other hand, were once the mainstay for these issues, but are now often reserved for more severe conditions due to their potential for misuse and addiction. Hypnotics are a broad category of drugs used to induce sleep, a vital tool in managing a variety of sleep disorders. Understanding these drugs and their mechanisms of action is crucial, whether you're a medical student studying for your exams or a health professional seeking to provide the best care for your patients. This knowledge allows us to use these powerful tools effectively and safely, ensuring the well-being of those under our care. So, buckle up as we delve into the fascinating world of these crucial drugs. First up on our list are the benzodiazepines. A fascinating class of drugs, benzodiazepines, often known simply as benzos, are like the superheroes of the pharmacological world, swooping in to save the day in a variety of situations. They are most commonly used for their sedative, hypnotic, and muscle relaxant properties, but their versatility doesn't end there. So, how do these wonder drugs work? Picture a city's electrical grid. In this analogy, our brain is the city, and the electricity running through it is the neurotransmitter gamma-aminobutyric acid, or GABA for short. GABA is essentially the body's natural chill pill, calming the brain by reducing neuron excitability. Now, benzodiazepines are like skilled electricians. They don't generate electricity themselves, but they enhance the effect of GABA, making it more efficient, like a well-maintained electrical grid. But as with any medication, benzodiazepines are not without their side effects. These can range from the relatively mild, such as drowsiness or slowed reaction times, to more severe effects like dependency and withdrawal symptoms. This is why it's essential that these drugs are used responsibly and under the supervision of a healthcare professional. Among the many benzos out there, you've likely heard of a few. There's diazepam, perhaps better known by its brand name, Valium. It's a bit of an all-rounder, used for everything from anxiety to muscle spasms. Then there's alprazolam, or as it's more commonly known, Xanax. This one is a heavy hitter in the fight against panic disorders and anxiety. And let's not forget lorazepam, or Ativan, often used to treat severe or persistent seizures. It's important to note, however, that while these drugs are incredibly useful, they're not a one-size-fits-all solution. Different benzodiazepines have different durations of action and levels of potency. For instance, the effects of Xanax can be felt more quickly than Valium, but Valium's effects tend to last longer. It's a bit like choosing between a sprinter and a marathon runner. Both are athletes, but they excel in different areas. So, why the deep dive into benzodiazepines? Because understanding these drugs is crucial not only for healthcare professionals, but for anyone who may use them or know someone who does. We live in a world where medications are a part of many people's daily lives. Whether it's to manage a chronic condition, recover from an injury, or deal with occasional bouts of anxiety, knowing what goes into our bodies, how it works, and its potential effects is a significant step towards better health and well-being. Benzodiazepines, though complex, are a vital part of modern medicine. They're like the multi-tool in a doctor's pharmacological toolbox, ready to tackle a range of conditions with their versatile actions. And now, equipped with a deeper understanding of these drugs, you're ready to delve further into the captivating world of pharmacology. Next up, we have the barbiturates. Let's dive right into it. Barbiturates have been around for quite some time, proving to be a fascinating group of drugs in the field of pharmacology. So how do these drugs work? Barbiturates act on the central nervous system. They enhance the activity of a neurotransmitter called gamma-aminobutyric acid, or GABA for short. Now, GABA is like the body's natural sleep aid. When it binds to its receptors in the brain, it slows down nerve activity. Barbiturates come into play by increasing the effect of GABA, thus causing a greater reduction in nerve activity. Picture a dimmer switch, where you're gradually turning down the lights. That's what barbiturates do to your brain's activity. Moving on to the therapeutic uses of barbiturates. They're widely used in the medical field for a variety of reasons. For starters, they're used as sedatives to help patients relax or sleep, and as anesthetics for surgeries. Additionally, they can be used for the treatment of seizures, as they help to calm the excessive electrical nerve activity that causes these episodes. It's like using a fire extinguisher to put out a fire. That's how barbiturates help control seizures. Now, despite their benefits, barbiturates come with potential risks. They can lead to physical and psychological dependence, especially when used for long periods or in high doses. Overdose can also occur, leading to life-threatening situations. The effects of an overdose can range from confusion and drowsiness to coma or even death. It's a bit like a tightrope walk. You need to maintain the right balance to avoid falling off. Some common examples of barbiturates you might have heard of include phenobarbital, pentobarbital, and secobarbital. These drugs, although useful, are typically used as a last resort due to their potential for abuse and overdose. It's like keeping a powerful tool in your toolbox, but only using it when absolutely necessary. To sum up, barbiturates are potent central nervous system depressants. They enhance the activity of GABA, leading to a reduction in nerve activity. They have a variety of therapeutic uses, including as sedatives, anesthetics, and anticonvulsants. However, they also carry the risk of dependency and overdose. Common examples include phenobarbital, pentobarbital, and secobarbital. It's important to remember that while barbiturates can be beneficial, they must be used with caution due to their potential risks. The key is to use these drugs responsibly and under the guidance of a healthcare professional. Clearly, barbiturates have a significant role in medical science. Their story is a powerful reminder of the delicate balance between the benefits and risks of pharmacological interventions. Now let's move on to hypnotics. Hypnotics, a fascinating class of drugs. They're like the superheroes of sleep, swooping in to fight off insomnia and other sleep disorders. But what exactly are they? Well, in the simplest terms, hypnotics are medications that induce and maintain sleep. They're the good guys helping millions of people around the world catch those elusive Z's. Let's delve a bit deeper. Hypnotics primarily work by slowing down brain activity. Imagine your brain as a bustling city, with thoughts and signals whizzing around like cars in rush hour traffic. Hypnotics step in, acting like a traffic controller, slowing down the hustle and bustle, allowing the city, or your brain, to settle into a peaceful slumber. Now, every superhero has their unique abilities, and hypnotics are no different. They come in various forms, each with its unique properties. Some of the most commonly used hypnotics include zolpidem, ezopiclone, and zaloplan. They're the Batman, Superman, and Wonder Woman of the hypnotics world, if you will. Zolpidem, for instance, is fast-acting and has a short half-life, making it perfect for those who have trouble falling asleep. Ezopiclone, on the other hand, is a bit slower to kick in but lasts longer, helping those who can't stay asleep. Zaloplan is the speedster of the group, fast to act and quick to leave the system, ideal for those who wake up in the middle of the night and struggle to fall back asleep. However, like every superhero story, there's always a potential for a dark side. Hypnotics, while incredibly beneficial, are not without their potential side effects. These can range from mild symptoms such as dizziness, headache, and nausea, to more severe effects like memory problems, sleep-related behaviors, and even dependency if used long-term without proper medical supervision. But don't let that scare you. It's important to remember that these side effects are not a given. They're potential risks. And with proper usage and under the care of a healthcare professional, hypnotics can be a safe and effective tool in managing sleep disorders. And there you have it. From their function as sleep inducers to their potential side effects and the commonly used examples, that's a quick run-through of hypnotics. They're not just sleep aids, they're a lifeline for those struggling with sleep disorders, a glimmer of hope in the dark night. So the next time you hear the word hypnotics, think superheroes of sleep, think zolpidem, ezopiclone, zaloplan. Remember their benefits, but also their potential side effects, and most importantly, understand their crucial role in the field of medicine. Hypnotics, while potent, serve an essential role in the medical field. Now that we've covered all three, it's time for a comparison. In this fascinating world of pharmacology, we've been introduced to benzodiazepines, barbiturates, and hypnotics. Each of these drugs has its unique features and uses, but they also share some striking similarities. Let's start with benzodiazepines. These are a class of drugs primarily used for treating anxiety, but they can also be used to manage a variety of other conditions like seizures, muscle spasms, and alcohol withdrawal. Their primary mechanism of action is enhancing the effect of the neurotransmitter gamma-aminobutyric acid, GABA, at the GABA-A receptor, resulting in sedative, hypnotic, anxiolytic, and muscle relaxant properties. But before the advent of benzodiazepines, there were barbiturates. These drugs were once the standard treatment for anxiety and insomnia. Like benzodiazepines, barbiturates also act on the GABA-A receptor, but in a slightly different way. Instead of enhancing the effect of GABA, they prolong the opening of the chloride ion channel, leading to a longer duration of action. However, because of their narrow therapeutic index and high potential for overdose and addiction, they've largely been replaced by benzodiazepines in clinical practice. Now, let's talk about hypnotics. These are medications used to induce sleep, and they include both benzodiazepines and non-benzodiazepine drugs. Non-benzodiazepine hypnotics, often referred to as Z-drugs, include zolpidem, zaloplan, and ezopiclone. These drugs selectively bind to a specific subtype of the GABA-A receptor, resulting in sedation without the anxiolytic or muscle relaxant properties. This selective action makes them an ideal choice for treating insomnia without the risk of daytime sedation or physical dependence. So, what's the takeaway here? All three classes of drugs, benzodiazepines, barbiturates, and hypnotics, act on the central nervous system to produce effects of sedation, anxiety reduction, and muscle relaxation. They all play with the GABA-A receptor, but it's how they dance with this receptor that defines their unique characteristics. Benzodiazepines enhance GABA's effect, barbiturates prolong the chloride ion channel opening, and hypnotics, particularly the Z-drugs, selectively bind to a specific subtype of the GABA-A receptor. However, they are not interchangeable. Each has its own indications, side effects, and risk of dependency. Benzodiazepines are safer than barbiturates, but they can still lead to dependence and withdrawal symptoms. Hypnotics, on the other hand, are primarily used for sleep disorders and have a lower risk of daytime sedation or physical dependence. In conclusion, while these drugs may seem similar at first glance, understanding their differences is crucial for safe and effective patient care. Understanding the similarities and differences between these drugs can greatly enhance your medical knowledge. Phew, we've covered a lot today. Let's take a moment to recap. We dove into the world of pharmacology, focusing on benzodiazepines, barbiturates, and hypnotics. We've seen how these classes of drugs, while different, share some common features, particularly in their mechanisms of action and their uses in medical practice. Benzodiazepines, we've learned, are primarily used for their anxiolytic and hypnotic effects. They work by enhancing the effect of the neurotransmitter GABA, leading to calming effects on the nervous system. However, they do carry risks, such as dependency and withdrawal symptoms. We then delved into barbiturates, powerful sedatives that were once the go-to for anxiety and insomnia. Like benzodiazepines, they also enhance GABA activity, but are less selective, affecting a wider range of receptors. Their potential for overdose and addiction has led to their decreased use in favor of safer alternatives. Lastly, we discussed hypnotics. These drugs, which include the Z-drugs, are primarily used for inducing sleep. They're generally considered safer than barbiturates, with fewer side effects, although some risks do exist, particularly with long-term use. We've also compared these drugs, highlighting their differences and similarities. Each has its own place in treatment, depending on the patient's specific needs and the potential risks involved. Remember, knowing these drugs isn't just about passing exams, but about improving patient care and outcomes. Until next time, keep learning and stay curious.